I think we have been constantly hearing to patient safety, making it a key topic and sensitizing each one of us on the importance of ensuring that the patient who comes in seek of care is safe in our hands. Patient safety is a global challenge that requires knowledge, skill in multiple areas, including human factors and systems engineering. And I'm sure this conference is combining both and giving us a lot of knowledge to take back to our respective places and put it into practice. The IOM report, "To Err is Human, Building a Safer Health System," is very frequently referred to. And it is a very rich literature for us to take forward to ensure a safe patient environment. The focus on medical errors that followed the release of the IOM report, "To Err is Human, Building a Safer Health System," centered on the suggestion that preventable adverse events in hospital were a leading cause of death in the United States. More than 70% of errors resulting in adverse events were considered to be secondary to negligence, and more than 90% were judged to be preventable. The chair of World Health Organization's World Alliance for Patient Safety, established by Sir Liam in 2002 to address the global response to improving patient safety, emphasized the importance of laboratory medicine within the global patient safety agenda, and emphasized on the need to monitor quality indicators to assess and monitor clinical lab process. It may come as a lab initiative. How many of us, from the nursing perspective, are interested to capture quality indicators related to lab process? I'm sure if I ask my quality executives in our organization, "Madam, we are already doing multiple indicators and data capture. Don't load us with additional indicators. We have no time. I think our quality will get diluted." But I think we have a key role in capturing this quality indicator related to the lab process. I'm sure you will all agree to this sentence. Physicians rely on accurate laboratory test results for proper disease diagnosis and for guiding therapy. It is estimated that more than 70% of clinical decisions are based on information derived from lab test results. The total process, testing process, begins and ends with the patient. You agree? You agree? Okay. It includes 3 phases. The total testing process can be subdivided into 3 stages. A pre-analytical test, where there is a test request, the patient and specimen identification, specimen collection, transport, assessing, and processing. The analytical phase, which is almost the lab responsibility, and the post-analytical, that is report test results, interpretation, follow-up, storage, retesting if needed, where we also collaborate at this phase. And what I intend to speak for today is basically more into the pre-analytical phase. The pre-analytical phase of the total lab testing process is where the majority of laboratory errors occur. The pre-analytical errors can occur at the time of patient assessment, test order entry, request completion, patient identification, specimen collection, specimen transport, or specimen receipt in the lab. Anything else beyond this? There's a study being conducted. It's a 1-year longitudinal study in 2008 to 2009 by Chawla and his colleagues. It is in the clinical chemistry lab on the frequency of pre-analytical errors observed in both inpatients and outpatients. For the inpatients, a pre-analytical error rate of 1.9% was reported. in patients was 1.9%. The variable receiving the highest frequency rating was specimen hemolysis at the rate of 1.10%. And for the outpatient, the error rate was 1.2%. And the variable with the highest frequency rating was insufficient volume for testing. Do we get this request very frequent? Sister, sample is not adequate. Send another sample. Yes? Sister, sample is hemolyzed. Send another sample. I think it is evidenced and seen, and the percentage is reported. Anything beyond this? Has specimens been collected? Breath, oral fluid, blood, urine, sweat, tears, breast milk, hair, nails, meconium, tissue, vitreous, organ, postmortem. Everyone, nurses involved? Nurses involved? Anything, and I'm sure that the list doesn't stop here. The list doesn't stop here. We are there everywhere, made accountable and responsible when there's a specimen. We cannot shun our roles and say, this doesn't belong to me in healthcare. There are a lot of variables that comes in terms of specimen collection. We do have patient variables. We have specimen collection variables and specimen handling variables. Patient variables could be in terms of diet. I hope it is visible. Is it? Yeah. Diet, body mass, age, medications, gender, smoking, pregnancy, exercise, race, dehydration. Do we have these questions to our patients before we take the sample? Anything that you can report in terms of how diet can interfere a lab sample? Any one of you? Organizer to any one of them with a mic? Possible? Possible with a mic to any one of them? Hand mic? Yes? Fasting? Postprandial? Yes? Lipid profiles? Yes? But how many of us think, why do we ask our patients to give a fasting sample? Do we really incorporate that knowledge behind asking our patients to say, come fasting or take a fasting sample? Why do I take a fasting sample? Do I have an explanation to the patient to say why I take a fasting sample? Body mass. Any variations? Okay. I would not be going into the depth of all variables. Give me something. Okay, something related to age. Age as a variable for sampling error. Is there a difference for the age? Yes. Neonatal HB? Yes? Okay. Medications as a variable, smoking, pregnancy, exercise. So how is it impacting? After a heavy exercise, a person comes to give a sample. Is there any impact? Yes? Yes, with an increasing exercise, there's a lot of sweating. So with a lot of sweating, there is an hormonal imbalance. When there's a hormonal imbalance, a person trying to check his hormone level in terms of ACTH or a cortisol can have a variation. Okay? So similarly, when we talk about specimen collection variables, it could be in terms of posture. Posture as a variable. Change in posture. I made you all stand for something. Specimen, yeah. Specimens. Sampling. It increases, change in position leads to increased secretion of catecholamines. Okay? Diurnal variations. Concentration of potassium, it decreases post-lunch in the afternoon. Cortisol rises during the day. Time of collection is a variable. Fasting status is a variable. Tourniquet. Yes. Potassium. Yes. Pressure or presence of IVs. Yes. How? Taking a sample from a line where you have an IV fluid? Dilution. Yes. Okay. Capillary versus venous, anticoagulants, the order of our draw. Probably my next slides will also show what is the order of drawing your samples also. You have your various evacuated tubes on which you could be collecting the samples. Specimen handling variables. I would be speaking a little more on the hemolysis. Lipemia, centrifugation, processing time, temperature, sunlight, evaporation. And all these are variables causing, which could be a predisposing factor for sampling errors.